Good morning, Leavenworth citizens. Thank you for joining our 5th Facebook Live Town Hall. Actually, this is the 5th one in a little less than 4 weeks. And we're going to focus again on COVID-19, which is what we need to be doing. And today I'm joined, as I have been in the 4 previous town halls, by the city manager, Mr. Paul Kramer. And we have a very special guest here today. Leavenworth County Health Department Director, Mr. Jamie Miller, has joined us, and will provide an update on the latest news related to COVID-19 and what the county is doing with respect to fighting and combating the spread of that disease. And if you have questions for Mr. Miller, please submit them at any time. And I'm going to turn it over to him in about a minute after I get finished just reviewing the statistics from the state. And as we've talked about, the Kansas Department of Health and Environment posts an update daily, and this was their posting yesterday, I believe, as of probably 11 a.m. So it's about 24 hours old. While we get started on this Facebook Live Town Hall, they're probably posting new information, but this was the information as of almost 24 hours ago. There are 1,426 cases from 62 counties, with 69 deaths reported as of 11 a.m. yesterday, the 14th of April. There have been 327 of 1,145 cases that have been hospitalized, and there have been number of positive tests is 334 conducted at a state laboratory and 1,092 at private labs within the state. And 772 of the cases are female and 648 are male. And just very quickly, looking at the counties, in terms of number of cases, it looks like Wyandotte has the most now with 345. Second is Johnson County with 323. Third is Sedgwick County, which of course is where Wichita is located, 205. Leavenworth is fourth with 90. Fifth is Coffee County with 41, and then Douglas County is sixth with 40. So that's kind of a review of what's happening at the state level. And I think this would be a great time for me to turn it over to Mr. Miller. Mr. Miller?
Well, thank you for inviting me. Real quick, as you outlined, those are the county numbers that the state put out yesterday, and we put out every day by about 4 o'clock on the county's website our current numbers that were also gathered and turned into the local health department. So our actually confirmed tests are 95 for Leavenworth County, just because of the offset on time on which the state receives, and we also turn those numbers also into the state. So that's why it's important that people understand when our numbers may not add up. We get a lot of that through the health department on questions. That is what those numbers mean. We, throughout the day, as the collection point for the county. So as confirmed tests come in, we're trying to get the most accurate numbers out and portray within our community what our confirmed testing results are. So as I said, we're at 95. Of that, however, I want to state that the number to really look at is the active cases. And active cases are those cases of recovered individuals and deaths minus the confirmed cases. So those are, we're at 78 because we have 16 people that have met the criteria to actually be recovered and are able to get back into the community and do those type of activities as they did before. So as we look at the doom and gloom, if you will, with COVID-19, I'm also trying to really push that recovered cases and put that number out as well. One of the other things that has been really looked at is hospitalizations. We're trying to track of those positive cases, how many are really needing that next level of care, if you will, inside. And a lot of questions have come out of that, or comments, if you will. Well, we saw that the numbers were 9 hospitalized yesterday, but the recovered hasn't gone up. We answered those questions back today, even on social media. Just because someone is released from a hospital does not mean they're recovered. It means that their signs and symptoms no longer necessitate the need for hospitalization, but it doesn't mean that they are completely recovered. They may be symptomatic and still have to retain home and isolation until the health department and such can release them on a recovered basis through very specific criteria. We have been very fortunate. It is deeply saddened that it is. We've only had a single death, which I'm going to tell you, my expectations was much higher than that at the point we are right now, but I'm going to refer back to, I believe Leavenworth County did a good job of getting ahead of the curve. We implemented some of the strategic mitigation planning and some of the stay-at-home orders, maybe even in front of the entire Johnson County and Wyandotte and us as part of the Mid-America Regional Council and the Metro really got together and followed those stay-at-home orders immediately as we saw these waves coming and we saw the numbers coming. I believe that really is what helps us in regards to what our numbers are and what we have seen throughout Leavenworth County. Because again, social distancing is so important and so anytime you're dealing with any type of virus like this is so it spreads so easily that if we didn't do that early on, we would have had a lot more hot spots. If we would have not started limiting some of our mass gatherings and things. I know it's kind of been a tiered system, and as we were speaking before, it's kind of like driving up the hillside with a truck to the top of the mountain. It's kind of been progressive as we get there. And we're going to probably have to see a progression on the way down because it's not going to be a immediate, okay, we hit the peak now, let everything open back up, or we'll be in a very rebound scenario and a second wave type scenario that we can be almost as if we were when we first started all of this because of all those individuals that have social distance and slowed down. If we would all start coming back together and shaking hands and going to church and going to all these mass gathering type things, like we did before, we have a recipe for destruction.
And I think we would undo the work that's been done thus far, the investment that's been made by the citizens and by the county officials and the city officials. So that's the worry, I think.
Absolutely.
So, okay.
Absolutely. So, any questions or anything else that I can answer for you?
I know that because it's been covered in the Leavenworth Times, there's been some cases of both the prison guards and the inmates at Lansing Correctional Facility, which is a state facility. But can you give us just a little idea of what's going on there? Sure. And do those numbers, go into your county numbers?
They do, because obviously those workers come back out into our community and into the homes and such, so we have to follow those contact tracings as well as we do with all of the 95 cases and plus some that we've had to track and follow. The one advantage we do have with LCF and Dr. Lee Norman, Secretary of KDHE, he assigned one of the lead and actually the director of disease and such from KDHE to come out and be basically the liaison for that facility, just because of the demographics, the structure of that, and to take some of that burden off of our health department to try to deal with that. And as you may have seen in some local news reportings and such, they're going to bring in some medical assistance from the National Guard to also assist with some of the quarantine and the temperature temperature monitoring and just all of those individuals in there have to be monitored. So it's very difficult. The staff out there is not in a position where, to handle that. Sure, right. So there's been some state support, obviously, in to help with that scenario with us, but we are working hand in hand with KDHE with that, if you will, outbreak within our community. We're doing some testing for them as well during while we do some of our testing out at the health department for those that meet criteria. They're also sending some of the staff, not prisoners. We're not doing any of the inmates or residents
Right.
there. We are doing and helping on the staff side of it, or family of staff and
Yeah,
such that
exactly.
that may need to have some of that testing done. So even though there's limited testing, because there's they need some of the critical infrastructures that need to maintain. Those are some of the things that we have to do at the health department as well.
Well, I'm glad that you're staying connected and staying tied to the staff, because many of the staff live in our communities, Lansing,
Correct.
Leavenworth, out in the county, so that's very good. Could you tell me, and generally I think the citizens in Leavenworth, the city of Leavenworth, the county are doing very well. Now, some of the essential activities are to go get groceries and things like that. So some of the big box stores such as Walmart and Home Depot are open, and of course the grocery stores. Are they doing some things to help, with the mitigation and that you're aware of, that in terms of dealing with the number of people that come in
They
there?
have, and obviously it's kind of been a struggle, because this is all new to everyone. That the big box stores and such, it's been a very hot topic, if you will, for the community of, there's 400 people inside Walmart. Why are we allowing that?
Yeah.
And again, it's a process. We have tried to work with a lot of the
Sure.
big box stores and such to try to put in some practices.
Okay.
Again, the state has put out their guidance as the executive orders somewhat superseded ours. I shouldn't say somewhat, they have superseded some of the local authorities. So we've been along the ride the entire time to try to do the best that we can for getting some of the social practicing. Again, it really boils down to the buy-in from the community.
Right.
It is really up to the community to do the right thing. And the right thing really in this is to social distance,
Right.
stay at home if you don't need to go out. The whole family doesn't need to load up into the car and go grocery shopping anymore. Those days are really kind of beyond where we're at. And the more that we can social distance, the quicker we're going to get through this and see what's on the horizon. But again, it's a no-win unless we have buy-in from the community, and those that are doing the right thing, I applaud them. Those that are still struggling, and we just try to keep educating along the way and giving enough information so people really take this seriously.
Sure. I've got a few other questions for you, but I want to remind our Facebook Live Town Hall participants, because I think some of you have just joined, is that our special guest today is the Leavenworth County Health Department Director, Mr. Jamie Miller, and I really appreciate him taking time out of his busy schedule to come here and talk about the county's campaign and fight against the spread of COVID-19. So if you have questions for him, please submit them, because it is really a great opportunity that he's here and can respond to questions from the citizens within our community. Any questions yet, Mr. Kramer?
We do have a question.
Okay.
We had a question submitted that said, some people have various symptoms other than the typical ones initially stated. What questions are nurses asking in the screening process?
Okay. From the very beginning, obviously, the very beginning symptoms were that fever, cough, shortness of breath was really the only focus. And as the nation has opened up and had tremendous amounts of research now on the different presentations of a patient that has come in, all the different symptoms, everything from fatigue, diarrhea, vomiting, GI, there's just a tremendous amount of symptoms that have continued to be added to the criteria as we are working through. Some of the other has there really been any association, or have you been around anyone that you're aware of that already has tested positive? We look at tracing and tracking history of where the individuals have gone. So again, predominant, it's mild to moderate symptoms is what we're seeing with a lot of the individuals, which again, there is no treatment, there is no vaccine currently. Right. So what that really means is that you're going to be symptomology treated. If you have a headache, you're going to take some sort of antipyretic type medication, acetaminophen, which is Tylenol and things of that nature. If you don't feel good, you're going to be at home, you're going to be resting, those type of things. And realistically, as you can see by the numbers of hospitalizations, even within our jurisdiction, very few out of the 95 are really needing that next to moderate to severe that are going to need to seek hospitalization, which is good because, again, this has been the focus on, we didn't want to overload, again, the hospital basis. And again, if we had, our numbers were extremely up, because we didn't do any social distancing, then we would have that problem here in the local of where we put them. So again, to get back to yours, all symptomology is looked at when they call in. We're not just saying, well, just because you had one small bellyache, if you will, are we going to rule out it's not this or it's not that? And again, everything is looked at when they call in and talk to a nurse under the criteria for COVID-19. We obviously are looking at trying to expand testing in the future. So that is something that we're on board. The biggest problem with testing currently is our testing goes to the state of Kansas, so we're under those guidelines of what we can send in to the state of Kansas. But what really pushed that was the limit of the actual swab itself having enough in the media, which is the tube on which we have to put it in to send it to the lab to actually be tested. It's just not available. And the problem with that is we've had orders for a long period of time trying to get additional in. We are in the region, the Kansas City metro region, trying to work through a public-private
Consortium.
Consortium of with some lab capabilities at KU Medical Center to be able to push more people through and get some more sampling through. There has been some different campaigns that have happened, but I'm going to tell you from the very beginning of this, we've done as much testing as we can possibly feasibly do with what we have available out at the health department, and really try to get a capture a good sampling, if you will, of what was happening. That's some of the reasons why some of the self-reporting probable cases were always being reported as well. Just because we knew we couldn't do as much sampling and testing of even those that met every sign and symptom, and other things were ruled out. And we said, absolutely, this is a good probable case of. But what we have found and what we've witnessed is over about the last 7 days, that number really hasn't gone up because, again, the criteria and some of the other testing has come on board with private testing, which has allowed us to actually get what I want, confirmed case numbers, not just probable case numbers. But I thought it was very important early on that we got that number out to individuals so they knew what the health department and what public health was really dealing with and seeing on the backside for probable cases within our area. So people understood that it wasn't, well, we only have one case. Well, you don't just have one case. There's probably this many cases that have called in with symptomology that matches and mirrors COVID-19.
Very good. And I appreciate you expanding a little bit and letting us know kind of a little bit of the inside baseball with respect to testing. And the numbers do look like they're increasing for the private private labs doing the. Now, who would direct a test? A physician or a medical person in terms of it going to a private lab for testing? How does that work?
No, there are certain criteria through the state, and again, we already work with our physicians here in the community. If they don't have the ability to test, then they will send that information to us to see if it meets the criteria for which we can send to the state of Kansas right now. If we do expand the testing, the expanding testing is really trying to open up for symptomology. So if people in the community have the symptoms and such, it would be a lot of these that are doing the self-report, we would be able to test at that point in time. And again, through our medical director and the medical community, we would already have that already in place. So it would just be, again, not a free-for-all drive-through. There would still be, just to make sure we're controlling this, and it has to be a very controlled environment because, again, the clinical staff that needs to take those samples are going to be in the proper PPE, and we don't need to have any sort of problems awry with that. And again, when you're taking laboratory from someone that just drives up, we need to know who that is. There's a process for that. So it would be by scheduled times and such to bring people in, but we would process a lot more people than we are currently doing at this time.
Do you think that could happen sometime in the future?
I do. I'm very optimistic that the biggest proponent or opposition that we're up against right now is we've ordered the testing. We're told the testing materials are en route, but they're not in hand yet. Once all of that can be in hand, then I think it's the game changer, and then we're ready to expand our testing. But I can't test if
Sure.
I don't have the materials.
Understand. And I think you've implied this with at least 2 or 3 of your comments, and with the numbers, not rising exponentially or anything, and seem like we're keeping a handle on keeping those numbers at a lower level. Are the hospitals in pretty good shape right now?
As the last numbers that I've looked at and through the Kansas City Metro, again, because of the structures that were in place and our ability to be kind of in the forefront, if you will, hospitals, I think, did a great job of canceling off some of those elective surgeries and freeing up and really being ready. Bed capacities and things of that nature, I think we're in good shape for the Kansas City Metro. But again, one of the big things that continue to pop up is PPE and keeping the hospital staff safe. So that's still a struggle, and that's still real in Kansas City, even though our bed capacity, I think I heard on a conference call yesterday, and it really came home to me, is for every person that is hospitalized, there's at least 8 times that PPE sets have to be changed out, and for all the different people that need to go in and out of those rooms. So when we talk about PPE, we talk about burn rates. How much are you actually using on a day-to-day? And so again, as we're talking about 6 people being in there and do just a simple math of 8, you're talking about 48 to 50 sets just for the 6 that are within Leavenworth County, let alone if we were to look at the hospitalization rates across the state. And that goes hand in hand also with our first responders, our EMS. Again, as I'm the EMS chief as well as the health department director and health officer for the county, I've got to look at what are those burn rates for when people are calling for an ambulance right now. The high susceptibility of someone out in the community that's having this. Both technicians need to be in full gear as well. So it's a very important piece for personal protective gear and equipment. And then also when it comes back, they have to decon the ambulance, and so there's more protective gear that has to be used and such. And it's been quite the last several months that we've had to really be up against and just trying to find this PPE as well as testing kits and all the other those things have been absorbed by other communities across the nation, across the world, because again, it's not unique to Leavenworth County. It's the same materials and the same gowns, gloves, masks, N95, shields, all of that type of equipment is being sought. We have received some of the Strategic National Stockpile from the national request, which is very important, why we made our declarations here locally as well as the state. But again, it was nowhere near the amount that is probably going to be needed to combat this. So we're still locally looking at vendors and trying to work through those solutions to go long-term with this to protect all of our healthcare providers that are within our community, and it's our people that live here as well. So it's very important as we go through to really understand the big picture of, a lot of times people just, they look at a number, or they look at, well, this is this or this is that for numbers that are on our sheets, but really understanding what that calculates out to as we move forward.
And go ahead.
I was just going to say, we do have 2 quick questions. I'm going to, for anybody listening, Jamie, I'll ask you to touch on this, just 2 quick items, and then if you could allow people to know where they can send additional questions. I know your time is limited today, so if you're listening, been great questions. We have a couple more, but I'm going to limit it to 2, and then Jamie, where follow-up questions could go, and then if you have 1 or 2 more, so then Jamie can get back to it. We had 1 quick question on testing for antibodies. I know that's been in the news a lot, and then we had 1 quick question on if you could just do a quick rundown on the status of the orders and how they overlap and what they are. I know it's confusing. So, and then give people the information on where they can now reach out to you once you're able to get out of here today.
And I'll hit that real quick. If individuals have specific questions, it's JIC, which stands for the Joint Information Center at Leavenworth County, spelled out, .gov. So again, jic@leavenworthcounty.gov. Questions can be emailed. Please allow for 24 hours to kind of get back. So depending on who needs to answer that question or what the question really is, and again, the influx of emails that we're getting into the JIC on a daily basis, we really try to get you an answer back within 24 hours. So make sure that you give us that information and time frame on that. The antibody testing, again, there's been a lot of rave, if you will, and kind of what does that truly mean and what is that going to happen. Currently, we do not have that availability. The last I was informed and such, the FDA is actually only allowed and authorized a single test that's out there for immediate FDA approval. But that doesn't mean that there's not multiple other tests out there currently on the market that others are trying to seek and put into play. The big question is there's really no research on it yet, other than, yes, you may have been exposed and it's in there, but what does that truly mean for the individual to have the antibodies in their body? And the problem with that is we don't know how long those antibodies are going to survive. There's been a lot of issue out there that people believe that, well, I had it, so I can't get it again. And that doesn't necessarily hold true nor water, because again, we don't know how long the antibodies are going to live in the body. Is that a 10-month process? Is that a 7-month process? 5 weeks? We don't know that process. There's not enough research. And again, there's been a lot that has come out of the actual COVID-19 team. Dr. Fossey and have put out many documents and many things talking about this because it has not been researched enough. CDC has even documented. I think this is going to come into play as we know more. And absolutely, if this is something that is going to benefit Leavenworth County in the long run, which again, any data, any knowledge that we can gain on this, I think is going to help guide us in decision making as we move forward with COVID-19. But as of right now, it is not available in Leavenworth County. And realistically, we're still trying to roll up to the peak and really get to the peak of this, and it's the symptomology patients and things of that nature that we're focusing on and really trying to get that testing, which we know what that does for us. So that's really the first that we're trying to go after on the testing process. The other side of that is we're talking about having to poke fingers and blood sticks and all the other kind of things on people that takes a lot more time and a lot more effort when we're really trying to still combat the symptomatic patients and try to get those patients taken care of. And then the secondary is the orders that have come out. And currently we are under 2 executive orders. The current order is 20. There's been obviously several orders that have come out, everything from dealing strictly with COVID-19 and social distancing all the way through the commerce side and things of that nature from the governor's office. We're currently under 2016, which expires on the 19th. And then the next order that was also put out was the 2018 order, which expires on May 1st currently.
But by the state, by the governor?
This is the executive orders of the governor. We are expected this week for the governor to probably put out an additional order or more guidance orders, if you will, really showing us and kind of either rolling back or what extension of time frames and such looks like for the state of Kansas. And that's also working through KDHE and Dr. Norman and all the other advice as everyone has been following nationwide, all the way from California and some of those and the East Coast as well, on what it looks like of getting America back to
More normal times.
What normal may look like.
Yeah.
And again, I think the key point to all of these orders, they're not light switches. These are dates that have been put out similar to when I had to put orders out into our communities. These are decisions based on scientific evidence that we have at that time, what things look like at the time, what our inundation to our healthcare looks like at that time. So all of that has to go into the equation Same thing, do we have enough PPE to continue? Do we have enough testing to continue? All of that will play major factors into how we come back off at the top of the hill. And as I used the metaphor earlier, you don't come barreling back down off the top of the hill with an 18-wheeler with no brakes. And if that happens, we're just going to, again, undo everything that we've done over these last several weeks and be in a worse, probably, position to have to go back into than if we do this very systematically and roll and come back down, as I like to say, smartly in making these decisions so that we don't have those rebounds, we don't have those waves back in, and I think we can do that here in the community.
That address that you gave out was JIC, G-I-C?
JIC.
J-I-C.
JIC, Joint Information Center at
leavenworthcounty.gov.
Yeah, so it's just the initials, JIC at leavenworthcounty.gov.
Yeah, and you made that decision, you and the Board of County Commissioners, very early on, and I think that was a great decision, that in terms of just tracking and kind of the command and control for this operation within the county. With my military background, I can really identify with that. Is that a 24/7 operation or?
Early on, it was very close to 24/7. It's virtual 24/7, but again, for about the last 6 weeks, I've probably worked 14 to 16-hour days, and again, we there at the JIC, we have call banks and people answering phones.
Sure.
For the most part, the phones have rolled back to kind of Monday through Friday, 8 to 5, because we really are pushing people to email in so we can get that back out with the appropriate, because not everyone answering the phone is going to be able to give every answer to every question that's there. So it gives us the opportunity to push that question around to the appropriate individuals to answer back and get the right answer out to people. And we've been doing our best to get answers out. Again, we have people that obviously are frustrated, scared, concerned, everything in between.
Sure.
And again, sometimes that just comes out in emails, and then when you can give them an answer back, they understand and can really, kind of grab around with that and roll, so.
Good. I'm going to make one more comment, and then we can let Mr. Miller go. Any other questions for
Nope.
him?
Thank you.
Thank you very much for coming. My best to your emergency medical technicians. I know that they're working very, very hard. We appreciate their expertise and their courage. And just let them know that we appreciate their service, and as do, I'm sure, most, if not all, the citizens within the city of Leavenworth and Leavenworth County. And I really do want to thank you for coming by and sharing your expertise and pertinent information with our citizens.
Absolutely. Thank you.
Thank you very much. I'm going to transition a little bit here, let Mr. Miller get back to his, what he does, at least 18 hours a day, probably longer. But I'm going to talk a little bit about stimulus funds that are available here to somewhat mitigate the severe economic consequences that are occurring to most of our citizens, certainly to our small business owners and small business employees. So the first point I'm going to talk about is that at our town hall last week, we announced that the city had been allocated approximately $201,000 in emergency community development block grants. The acronym for that commonly is CDBG, specifically to be used for community relief from the effects of COVID-19. Guidance on the rules and regulations have been slow in coming down from the federal government, but we did receive the regulations this week. Staff is finalizing 2 distinct uses that I want to let you know about. A portion of the money will be made available for small business grants. The individual grant amounts have not been finalized, and there will be some restrictions based on requirements from the United States Department of Housing and Urban Development, but the city is working to get those funds out as quickly as possible. Once the applications are complete and the framework is approved, they will be posted on the city's social media sites and website, and we will, through our city website, and particularly the COVID-19 information portion of that website. We will keep citizens informed of key milestones and key dates as we move through this process. A second portion of the emergency CDBG funds will be allocated to those social service agencies that are providing the most vital services during the pandemic. We know that food pantries are being stretched to their limits. We know that rent and utility assistance programs are struggling to meet the demand, and we know that agencies that serve victims and the most vulnerable need help. As that funding amount is finalized over the next week or so, and we meet guidelines on public notifications, the Commission will approve a plan to get emergency aid out as soon as possible to these agencies. One more note related to emergency funding. At last night's City Commission meeting, the Commission authorized the transfer of $35,000 to Catholic Charities for use in rent and utility payment assistance. The city has also been in talks with the Leavenworth Water Department, who is looking at a similar action specifically related to relief from water bills for our citizens who are in some straits in terms of having a challenge in terms of paying their monthly water bill. So that's good news, and the Commission did make that decision last night after a recommendation from the city manager and staff, and that should be taking place very, very soon. Mental health. One of the most common questions we've received during this time is about mental health and the effects that the stay-at-home order, the stress of a reeling economy, and the impact of social distancing are having on our residents and our citizens. We have reached out to the Leavenworth Guidance Center and hope to have a guest next week who can provide some information and resources for those types of concerns and issues. This week, I want to highlight a service that was recently publicized by the Leavenworth School District. The Kansas Children's Service League, KCSL, Parent Hotline, and this parent hotline can be reached at 1-800-CHILDREN. 1-800-CHILDREN is designed to meet the needs of parents and caregivers who feel isolated and frustrated when trying to meet the challenges of raising children and meeting all their needs in this situation that we're in now, which is certainly different from what we've been used to throughout our lives. Not to mention the added responsibility to help our educators who are instructing our children through distributed learning in most cases because they're not in school, and parents and caregivers, you know, are going to help, and that's another added pressure to the things that parents have as a responsibility in terms of raising their children. This is just one more thing, very, very important, but it is another item that is added to our parents' plates. Information, referrals, and support are provided through this hotline, are provided statewide anonymously to parents, relatives, caregivers, youth, and professionals 24 hours a day, 7 days a week. And this Kansas Children's Service League, they are a nonprofit organization that is partnering with the Kansas Department for Children and Families. So they are a nonprofit partnering with the state Department for Children and Families. To give you a little background on the origin and this particular Kansas Children's Service League. The Parent Helpline is also available as a mobile phone app. This is a free download that can be found by searching the Parent Helpline in either the Android or Apple stores. And it would be an app that would be found by searching the Parent Helpline in either the Android or Apple stores. The app also contains links for parent tip cards on the Kansas Children's Service League website, or has simple one-touch dialing if you decide you need additional information. And top reasons for calls to the Parent Helpline, once again, 1-800-CHILDREN. include basic parenting, child development, behavior management, questions about reporting child abuse and neglect, mental health, legal concerns, and information about programs and services. And you can call the Parent Helpline at, once again, 1-800-CHILDREN or 1-800-332-6378, which are the numbers associated with the word children, I'm sure. And that number can be called for resources, referrals, and other key information. So if you have questions about that, go ahead and submit them, and we're just learning about this particular resource, and we'll get more educated and more up to speed as the days go along. I'm going to turn it over to the city manager for a couple of minutes and ask him to just provide a little bit of an update on city services and what he's looking at with respect to the staff 1 month, 1 month plus a few days into this health crisis.
Thank you, Mr. Mayor. Good morning, everybody, and thank you all for joining. Please continue to submit your questions. We've had a lot of great questions today and a lot of great topics. The mayor touched on the mental health issue, and we've gotten a couple comments on that. He did mention that we're going to reach out to the Guidance Center to see if we can't get a resource maybe next week for that. So I think that'll address some of the comments we've just been recently getting. I want to turn to city services. We are in the third week of City Hall, the Riverfront Community Center, and basically all city facilities being closed to the public. The city continues to work. We continue to operate as far as having our projects, our road projects, our infrastructure projects ongoing. But I wanted to give you just a little bit of look into what we're planning on now. As the health officer, Mr. Jamie Miller, said, the ramp up is one aspect that we're still working on. We haven't reached to the peak, but then the ramp down is equally as important. With that in mind, I think you can expect when city services do resume to be on a limited basis as we transition slowly back to a full open city facilities and city services. And I want to give you just a brief idea of what that will look like. Let's look at two popular services, recycling and the brush site. We will not open those services before April 24th. That is the end of the county order, the 23rd, and then the 24th is a Friday, and takes you just to about the end of the state order. What we would maybe look at, and what we're in the works on planning, is those next following weeks, whether that's the 27th or even a week after that, is what can we do to open those services in a responsible and prudent manner? How can we adjust services at the recycling center? Maybe we can bring cars in off Pennsylvania and stack them through city property and allow limited use. So we are working on that. We are not going to just wait until there's an all clear to open those. If we can responsibly and safely look out for the welfare of our residents and open those services, we will do that. So those would be things like the recycle center, the brush site, potentially something like dealing with trash bags. I know trash bags have been a big issue. The Lions Club, I will remind anybody watching, the Lions Club does still plan right now to deliver trash bags on May 30th. And then there's also some other city operations like animal control that you still can right now do in a virtual manner, but we may have a little bit more of a soft opening as we move forward. So nothing yet. I don't want to put any dates out yet, but that is our goal, is to slowly open these as we move through the next couple weeks. The only other thing I wanted to address is city employment. We have positions still open for a firefighter in our wastewater plant and for our refuse. For our refuse collectors, they are working long days. The decision to close the brush site has had a lot of effects. One of it is there's more refuse out there. And so it's a very difficult job, but a critical one for the city. So we do have positions open there. So those are the issues that I wanted to cover, and I'll continue to monitor any other questions, but that's all I had for now.
The questions with respect to mental health, would it be best to maybe save those for, and I think Mr. Ricard, the executive director from Leavenworth Guidance Center,
Yeah, and the questions are really just concerns about rather than specific
Yeah,
questions. So
yeah.
I think that everybody who's asked those questions or has brought up that topic, I think we could hit on those next week.
Okay, and if you do need help, I mean, go on the internet and I know everyone doesn't have the internet, but they have a helpline, they have a line that could be called, the Guidance Center. They've put some of their staff on furlough, but they are still doing mental health work in a distributed fashion. And so we've talked about that organization, we've talked about the Alliance Against Family Violence, we've talked about the United Way of Leavenworth County, and I know I'm missing other, CASA. There are a lot of great organizations that help people within the city of Leavenworth and within the county. So if you really are at a loss in terms of the actual contact information, I'm sure you could submit a question to Melissa Bauer, our public information officer, and she would be able to get you that information. But if you do have access to a computer and the internet, there's just a lot of great information available here at the city, but also on the websites of these various organizations. And one of them that I wanted to talk about, and I'll talk maybe for about 5 minutes as far as trying in an advocacy support way for our local businesses in terms of what's happening, what some of our organizations are doing to provide them, small business owners, the information that they need. I think in terms of that provision of information, in terms of knowing what to do to apply for these various loans, I think that's going pretty well from what I can tell. My conversations with Leavenworth Main Street Director Wendy Scheit. I talked to one of the prominent heads of one of our banks within Leavenworth late last week, and he was indicating to me that that 2 or 3 of his clients of small business owners had already, been able to get that payment protection program loan. Went through the entire process and the money was actually in their account. And I know 3 is not a large number, but while I haven't checked with him since then, he indicated that there were some others that were in the queue and that he was pretty certain that within a couple of days that there would be others. And this was just one particular banker, and this is being repeated by, I would say, probably all our banks working with small business owners and applying particularly for that Paycheck Protection Program, which was that loan that came out when the Congress passed about 2.5 weeks ago, that $2.2 trillion relief package. $350 billion of that was dedicated to helping small business get through the crisis, the immediate crisis that most of them are in going forward. And I think I mentioned last week that Congress was looking to maybe increase that by some $250 billion. Well, that didn't work out, but I gotta believe that sometime, hopefully in the next week or 2, that they'll have this additional tranche of money that can be applied. Because I haven't received word that all that $350 billion has been already, issued to small businesses. But I mean, you hear some things in a general sense via the media, cable television, that says that they could be, that those funds could be exhausted. But I don't know, if you just got to apply the basic guidance that I gave last week after talking to Mr. Will Katz, who's the director of the Small Business Development Center at the University of Kansas on the campus in Lawrence, is that small business owners should apply for 2 loans. In addition to the Paycheck Protection Program, there is another loan that has been around for a good while. It's directly through the Small Business Association, and it's called the, hold on a minute, the acronym is EIDL, and that stands for Economic Impact Disaster Loan, EIDL. And just that's a loan that is small business owners can apply for. This was even before the current COVID-19 crisis, that they apply directly to the Small Business Administration for working capital loans, and available for small businesses, small agricultural cooperatives, and most private nonprofit organizations. And funds can be used to pay fixed debts, payroll, accounts payable, and other bills that could have been paid had the disaster not occurred. But what Mr. Will Katz had recommended is that small business owners apply for that. And I think many of them have already done that, even before they applied for the Paycheck Protection Program loan. So if you haven't, that would be the approach. It's hard to get into too much more in the way of specifics during a Facebook Live town hall like this, but that was his guidance, and I think it's something easy to understand and to retain, and that would be my continued recommendation with respect to our small businesses. And of course, that, that 350 billion, that 2.2 trillion, that part of that 2.2 trillion, that was part of the Coronavirus Aid, Relief, and Economic Security CARES Act. So when you hear that CARES Act, that's what we're referring to, and that was that third phase of, Congress passed 3 bills. That was the third one, and of course that was the most lucrative in terms of the amount of money that, from a fiscal standpoint, that was injected to meet the needs of our society and our country, and the 350 billion dedicated to our small business owners. Just to give you a little idea of how this works, just very quickly, our small business owners, and this was from this business, the banker I talked about, and the clients, the people who are the small business owners, apply with the bank for a loan under the Paycheck Protection Program. Then the bank submits the application to the Small Business Administration for approval. Once the bank has approval and authorization from the Small Business Administration, the client executes the loan documents and the funds can be dispersed. And so the loan is a bank loan with a Small Business Administration guarantee. The whole process from completed application to close can be done in a few days. Now, I know initially when they rolled out that program 10 days ago or 2 weeks, there were some information technology challenges. I think those have been worked through, but I just wanted to give you a little idea. Pretty straightforward as far as the process for the bankers and our small business owners. The only other thing that I'll talk about is the Leavenworth Main Street website. Really good website in terms of resources for small business owners and employees. One of the things that they have on their COVID-19 resources tab or page as part of their site is the Leavenworth Times Local Business Directory. And this is a listing of businesses and restaurants operating in the Leavenworth and Lansing area. And it's a really good directory, easy to go through. Those are the restaurants and businesses that are open, essential businesses that are open in Leavenworth, many of them downtown, and then the restaurants who provide curbside takeout or in some cases deliver food, not only within our community but also to Fort Leavenworth. And last week, Ms. Wendy Scheit had an opportunity to participate in one of the Garrison Commanders' Facebook Live town halls and was able to talk for 5 or so minutes to the military community on Fort Leavenworth as far as the restaurants and that are offering that particular service. So I thought that was good as we're trying to work closer and closer together with Fort Leavenworth during this COVID-19 health crisis. There's also a Facebook page for restaurants in Leavenworth, and the Facebook page, I think it's a group that may have been just recently created, is called Food in Leavenworth. Once again, it's right there on, when you go to the leavenworthmainstreet.com web page. And then Leavenworth Food to Go during COVID-19, it's a Facebook page for restaurants offering curbside pickup and then delivery services, as I just talked about. There's other good links there as far as resources that can be provided for not only small businesses, but sole proprietors and independent contractors. One of those sites is the Leavenworth County Development Corporation, LCDC. Of course, we have the city of they have a link to the City of Leavenworth website where we have COVID-19 resources prominently posted, and then the Leavenworth Lansing Chamber of Commerce is another URL, another link on the Leavenworth Main Street website. So I just offer that information to you if you're interested in checking it out. That completes the great majority of the information today for this 5th Facebook Live Town Hall. And I'd just like to say that my assessment is that, backing up and reinforcing what Mr. Miller said, I think the great majority, almost all our citizens are doing a great job with respect to adhering to the provisions of the stay-at-home orders and only going out, in most cases, to do those essential activities such as grocery shopping, such as going to one of our restaurants to do curbside pickup periodically. I know that's what my wife and I do periodically. And then maybe going to the pharmacy or one of the drug stores to pick up required medication. Those are some of the essential activities. There are a few others, but I would just, as Mr. Miller said, just plan those trips to get the groceries very strategically. Try to do them less frequently than maybe we were used to in the past. And if at all possible, leave the children home with another adult, either a spouse or a caregiver, so we can minimize the number of people in some of the bigger box stores, including the grocery stores and Walmart and Home Depot. But generally, things are relatively quiet. I don't see a lot of cars on the road, even during the day. When I drove in here to the city commission meeting last night, I had to go across Delaware. I looked to the left, I looked to the right, and there wasn't a single car parked on Delaware. Now, that's not a good thing in the long term, but right now it's really what we need to see. And I was very happy to see that last night, and hopefully in the not too distant future, we'll be able to gradually get back to what we were used to. But right now it requires everyone making sacrifices, and I do appreciate the citizens of Leavenworth making those sacrifices for yourselves, for your families, and for our fellow citizens. I would just like to remind people that we are focused on just making sure we do the best we can with respect to focusing on protecting people's health, welfare, safety. That's our prominent and most highest priority as a city commission, as a city government, for the citizens of our great city, and we will continue to focus on that as we move forward. Once again, my thoughts and prayers go out to the county citizens who have contracted the virus, and of course their family members and all members of the healthcare profession within the county, and the emergency medical technicians, as we talked about, the doctors, the nurses, the respiratory therapists, the nurses' aides are all doing great work, challenging work, courageous work here within the county, and of course across our nation, as anybody who just tunes into the television for a few minutes or a little bit longer than that during a day will see. And some of them are giving the ultimate sacrifice in terms of our members of the health profession, and I do think about them often and pray for them and their families. And just remember what our health professionals have been telling us, and I've mentioned this in the previous Facebook town halls, just to stay safe, stay healthy, and stay home. That's what we need to focus on now. I think, as I said, we're doing very, very well generally as a community doing that. And We'll keep up these Facebook Live town halls, and I think the next one right now will be scheduled for a week from today, probably the same time, 11 a.m. And I do believe we will have one of the professionals in mental health coming here from the Guidance Center. Hopefully it'll be Mr. Keith Ricard, the executive director. He and I talked last week, but in the meantime, have a good rest of your Wednesday and a good rest of your week, and we will talk to you again next Wednesday. Thank you.